Just as we have defibrillators, there should be Narcan right next to the defibrillators.
The opioid crisis was recently declared a public health emergency by the White House, but here at the Bronx Opioid Community Summit at Metropolitan College of New York, Councilmember Rafael Salamanca, who is leading the charge to ensure that local organizations are empowered to save lives, including creating legislation to make Narcan, which reverses the effects of an overdose, available in all public schools, says the problem has been with us all along.
We've been hollering and screaming about this issue for decades, but we also have to take advantage of the fact that the attention that is getting nationally, which means that funding is going to come down the line to address these issues.
In 2016, 64,000 nationally died from an opioid overdose. Because of this, Acacia Health Network brought in close to 50 local providers to talk about treatment.
We are losing precious lives to an epidemic that has been in our community for half a century.
Hailing the early work of community activist Julio Martinez, who during the 50s, 60s, and 70s helped bring drug treatment centers to the Bronx, Executive Director Raul Russi says he's encouraged by the new proposals by the City Council, including safe rooms.
I'm actually a member of a group that is going to hopefully open 5 of those clinics to have people who are injecting do it in a safe way and being viewed so they don't overdose and lose their lives while we deal with them, trying to find a way to ease them into treatment.
Ultimately, that was the cause of his death because his kidneys and liver shut down as a result of it, and he was addicted to opioids for over 30 years.
Executive Director of the 3rd Avenue BID, Michael Brady, shared the effects of doctor-prescribed opioids that became addictive for his father, who suffered after a car accident. And he's not alone. Reverend Raymond Rivera, founder of the Latino Pastoral Action Center, shared his stepdaughter was addicted to opioids. She recovered and now helps other girls in recovery. In his remarks, he urged leaders to incorporate faith and spirituality when treating victims.
Most people in treatment rediscover spirituality, so it has to be available. We have to destigmatize it. It has to be part of the interdisciplinary approach.
Today's conversation is about getting Bronx community-based organizations and citywide community-based organizations together and brainstorming on different ideas or methods that have worked for these organizations, putting a Bronx Borough plan together and moving that agenda forward in government.
While there are no easy answers, all the stakeholders are here, and their goal is to end the opioid crisis in the Bronx. For Bronxnet, this is Arlene Makoko.